everyone, welcome back to my channel. I'm Dr. Sharona Dayan. For those of you who don't know me, I'm a Harvard-trained, board-certified periodontist practicing in Beverly Hills, California. And recently, I wanted to share with you a patient who came in who has been struggling with her teeth her entire life, and she lost several of her teeth because of gum disease. Then she went and got dental implants, and now the dental implants are losing bone. And I am helping her with laser treatment for failing dental implants, which is really effective. But I want to get to the root cause of her issue so that this doesn't keep happening. And she's so frustrated that she feels like her teeth have been a struggle for her entire life. And when I sat down to take a thorough history, I realized that she has been mouth breathing her entire life since she was basically born. And I wanted to talk to everybody about something you may not know, which is that mouth breathing can have really serious consequences for teeth and dental implants. And you can actually lose bone around dental implants and around teeth as a side effect of mouth breathing. So how does that happen? There's a few reasons. First, when we breathe through our mouth, we lose more moisture. There's 42% more moisture loss when we breathe through our mouth than with the nose. So if you hold up your cell phone or a mirror and you breathe out with your nose, you'll see a little halo of moisture. But if you breathe with your mouth, you'll see the halo is bigger because we lose more moisture. And why is this bad? Well, when your mouth is dry, it can become sticky and bacteria and food stick more, and you don't have the natural cleansing action of the saliva. So that's one of the reasons. It's just dry mouth. The second reason is saliva has a buffering capacity. It neutralizes the acids in our mouth. So when our mouth is dry, we lose that buffering capacity and the mouth gets more acidic. And let me tell you, the bacteria that cause tooth decay and gum disease love acidic environments. So then the environment becomes more conducive for the bacteria to grow. And also, our saliva has IgA, immunoglobulin A, which is part of our immune system. So when we have a low salivary flow, then we also don't have the full benefit of our immune system. Now, other things happen too when mouth breathing becomes a habit. When we breathe through our mouth, the mouth is open and the tongue is low. This is called a low tongue posture. And this is not good. The tongue is meant to posture at the roof of the mouth. That's the resting posture for the tongue. In fact, the roof of the mouth is shaped like this so that it can house the tongue. So when you develop a low tongue posture, over time, the muscles of the tongue, especially the back part, and the muscles of the lip and the cheek get weak, and then it becomes very hard to posture the tongue up, and this open mouth becomes a habit. And then when you want to swallow, in order to form the seal, the tongue is not posturing up against the palate. The only way it can form a seal is by pushing against the teeth and forming that seal that you need for the swallowing mechanism. So imagine that we swallow 500 to 1,000 times a day, and every time we swallow, you can exert 4 pounds of pressure on the teeth from the tongue. That's a lot of force. It's enough force to cause bone loss around dental implants and teeth. It's enough to cause gum recession. It's enough to cause teeth shifting. Ever wonder why you have to have a retainer after braces? Usually it's because of the action of the tongue and the lips not being in balance and being in harmony. And when we breathe through our mouth at night, we don't go into deep sleep and we start grinding our teeth. And that is another reason why we can lose bone around our dental implants and our natural teeth. So I hope that this video has just given you some ideas about why it's so important to breathe through the nose. The nose is the organ for breathing, not the mouth. The mouth is for eating delicious food and for speaking to each other and communicating and for kissing, but not for breathing. So if you're having trouble with your teeth and dental implants, ask yourself if mouth breathing could be one of the reasons why. Thank you so much for watching today's video.